Hi everyone, I'm Chris Davis and I'm going to give a presentation on the use of cognitive behavioral group therapy in nursing home residents with depression. The number of older adults is growing at a rapid rate. This means more people moving into nursing homes. Nursing home residents are members of society who are some of the most vulnerable. They have extensive issues such as their social concerns, financial concerns, their medical concerns, and of course mental health concerns. Depression is one of the most common, and for nursing home residents it's much more prevalent than it is for the elderly living in the community. For nursing home residents, depression goes beyond them feeling sad, self-isolating, having negative thoughts, or even being suicidal. Research now shows that depression is a significant risk factor for mortality and morbidity. Cognitive behavioral therapy, CBT, is a well-known treatment that's been shown to be effective for depression across a wide range of ages. Limited research has been conducted, though, on its use in a nursing home setting. This research expands on previous cognitive behavioral group therapy research by examining for effectiveness specifically among nursing home residents. For this study, 9 females and 7 male residents volunteered, ranging in age from 52 to 87. They were all showing signs of depression according to a Beck Depression Inventory at baseline, ranging from mild depression to extreme depression at baseline. All but 2 actually indicated moderate to extreme depression. A CBGT protocol, a cognitive behavioral group therapy protocol, was based on the work of Steer and Hammond, which involved an 8-week psychoeducational group about cognitive behavioral therapy, which was led by a licensed clinical social worker. To measure depression, the Beck Depression Inventory was used, which contains 21 items to assess attitudes and symptoms correlated with depression. A score of 10 or more indicates symptoms of depression, and this test has been shown to produce consistently high alpha coefficients and concurrent validity. The variables being measured were time 1 and time 2, pre and post intervention, as well as their BDI scores, or depression scores. Participant scores were taken prior to the intervention to establish a baseline, and then they were taken again after the intervention. To determine if CBGT was effective for the nursing home residents, a Wilcoxon-signed rank test was used instead of a paired samples t-test. All 9 female, 7 male residents involved in the study remained in the class for the entire 8-week period. The Wilcoxon sign rank test compared difference in mean scores pre-intervention compared to post-intervention, which revealed a statistically significant reduction in depression scores for participants following the CBGT class. Z equals negative 3.52, p-value of less than 0.001, and there was a large effect size, R equals 0.62. The median score on the Beck Depression Inventory decreased from pre-intervention 29 to post-intervention 15. Following the intervention, the percentage of participants measured as having depression according to BDI scores had decreased from 100% at pre-intervention to after the intervention there were only 69% who triggered for depression. And of the 16 participants, 5 of them no longer triggered for depression at all, and the number with moderate to extreme depression had dropped from 14 to 6, which was a decrease of 57%. As the need for nursing home care increases, along with the number of elderly continuing to rise, there are going to be more nursing home residents, and there are going to be more nursing home residents who are struggling with depression. Being a risk factor for mortality and morbidity justifies early and aggressive intervention, and this is one area where social workers can take note as an option for treating depression in a way that hasn't been widely used, but has shown some promising evidence of its potential effectiveness.